I'm Dr. Drew Lighthart. I'm an orthopedic surgeon at Vermont Orthopaedic Clinic in Rutland Regional Medical Center, specializing in conditions of the hip and knee. I decided I wanted to be an orthopedic surgeon, actually, not just a doctor, when I was 11. I had an injury and had surgery on my knee, and even prior to that was really interested in science and biology and things like that, but that sort of cemented it for me that I remember quite clearly deciding that that's what I wanted to do. What I enjoy specifically about orthopedics is that it makes a big difference, and it typically makes a big difference for patients quickly. So, you know, that's either selfish or selfless, depending on how you look at it. I love coming to work, and in general, the overwhelming majority of the time, having people say, this is great, it's life-changing, I should have done it a long time ago. It's made a huge difference in my life, and I couldn't be happier with having done it. Everybody here works together really well as a team to collaborate, and everybody has only one goal in mind, the care of the patient and the best interest of the patient. And I've been in big community hospitals and small community hospitals. I've been in huge academic medical centers and smaller academic medical centers, and there's always the need for collaboration, and the more difficult the case, the sicker a patient, the worse the injury, the more people need to be involved. And in general here, it works better than just about everywhere else. It's never for the doctor to tell you you need a hip or a knee replacement. It's for us to make a diagnosis, try the treatments that don't involve surgery, and when and if those don't work, explain what's involved with a hip or a knee replacement. Some people want a joint replacement the minute they have a twinge of pain, and my job is to explain why that's not when we do it. And some people would rather be in a wheelchair than go through surgery, and occasionally that's appropriate, and it might be the right decision for them, but everyone else is somewhere in between. How do I know what the best thing for this patient is? Treat them like they're your own family member. And that really holds true for what I do every single day. You know, if it's a patient with arthritis that's of an age that they're potentially having a joint replacement, I just have to think about, well, what would I want from my parent or my grandparent? If it's a kid with an injury, it's easy for me to imagine that now with 4 kids. If it, you know, it's what would I want for my wife, my kids, my parents, my grandparents? People will ask me, other physicians, other orthopedic surgeons will say, don't you get sick of doing the same thing over and over? You really only do 4 surgeries, right hip, right knee, left knee. That's the big joke in joint replacements. I would say I've never done the same surgery twice. The variety is what I like. Even though I might do 6 hip replacements in a single day, not one of them that I've ever done has been exactly the same. So I like the repetition and the being very, very facile at one set of procedures, and we're all like that in this specialty. We're all very subspecialized, and that's why, but they are never exactly the same. So there's always a challenge, there's always something slightly different, there's always a little bit of a nuance or combination, and it may not just be the surgery, it may be the patient and their other medical problems. And I like the variety and challenge of managing that. I like the variety and challenge of all the different patients. We don't have a very homogeneous population of patients here, and that's wonderful. We treat people from all over the place in all walks of life, and that's great. You know, some other places are limited geographically or economically, or private practice versus employed practice or academic practice, and we really get to do and see it all here, which is wonderful.